All right, let's jump right in. Today, we're digging into a really powerful idea, one that could totally change how we think about our well-being. We're going way beyond the hospital, beyond the doctor's office, to uncover the hidden things that really shape our health.
So let me just start with a kind of provocative question. Is your zip code more important for your health than your genetic code? I know it sounds a little crazy, right? But stick with me, because by the end of this, you'll see why the answer is, surprisingly, yeah, in a lot of ways it is.
To even begin to answer that, we first have to completely rethink what health even means. It's so much more than just not being sick. It's about intentionally building a world where well-being is literally woven into the fabric of our communities.
Now, the core concept here is called sustainable development in health. Don't worry about the jargon. It's really about shifting our focus from quick, short-term fixes to creating real, long-term solutions. It's about designing our entire world, our policies, our environment, our economy, to support good health for every single person, not just for today, but for generations to come.
And you know, this isn't some new fringe idea. It's actually right at the heart of the United Nations' big global goals. See, good health doesn't exist in a vacuum. It's directly tied to things like clean water, fair societies, better cities, and climate action. You can't have one without the others. They're all different pieces of the exact same puzzle.
And this leads to a really crucial idea called health in all policies. The thinking here is simple but powerful. Every single decision a government makes, whether it's about building a new road, funding schools, or planning new neighborhoods, every one of those decisions has a direct impact on our health. It's all connected.
So let's break this down into 3 key pillars. The first one is all about our social foundations. You can think of these as the fundamental building blocks for any healthy society.
Okay, get ready for a number that might just blow your mind. 50%. That's right, research shows that up to half of our health is determined not by doctors or medicine, but by social and economic factors. That is a total game changer.
So what are these social determinants anyway? Well, it's the stuff of everyday life, really. The conditions we're born into, where we grow up, where we work. Things like having a stable job, getting a good education, feeling safe in your community, and living in a decent home. These aren't just nice-to-haves. They have a massive, direct impact on how healthy we are.
All right, on to our second pillar, and this one is impossible to ignore. It's the direct, unbreakable link between the health of our planet and the health of every single one of us living on it.
And the stakes here, they couldn't be higher. The World Health Organization estimates that nearly a quarter, a full 25% of all deaths around the world are linked to environmental risks. Just let that sink in for a second. That's 1 in every 4 lives lost because of the condition of the world around us. And these aren't some abstract, far-off risks. We're talking about the air we're breathing, the water we're drinking. We're talking about the very real impacts of climate change and the loss of green spaces that we now know are so crucial for our mental and physical health.
But here's the good news. We know what to do. Things like moving to clean energy, creating more parks and green spaces, and building health systems that can withstand climate change. These aren't just environmental policies. They are absolutely essential public health strategies.
This brings us to our third and final pillar, the fight for health equity. And at its heart, this is all about one simple thing: fairness. It's the idea that every single person deserves a fair shot at living a long, healthy life.
Now, to really get this, we have to understand the huge difference between equality and equity. Equality is giving everyone the exact same bicycle. Sounds fair, right? But what if one person is a little kid and another is 7 feet tall? Equity is about making sure everyone gets a bicycle that actually fits them. In health, that means giving people the specific support they need to really thrive.
And the barriers to getting that right-sized bike, well, they're very real. It could be living in a rural area miles from the nearest clinic, or not being able to afford insurance. It could be a language barrier, or not having access to technology. All of these things create these huge gaps in people's health.
So, with all that in mind, how do we actually build this healthier future? Let's switch gears now from the problems to the real, practical solutions. Technology and innovation are going to be absolutely massive drivers of this change. Just think about it. Telemedicine can connect a patient in a tiny village to a top specialist halfway around the world. Big data can help us spot disease outbreaks before they even start. AI can help doctors make diagnoses faster and more accurately. When we use it right, technology is an incredible force for a healthier, fairer world.
But look, this isn't just a job for big tech or governments. It's also about us, the choices we make every day. the local programs we get involved in, and our willingness to speak up and advocate for better policies, all of that creates a ripple effect. We all have a part to play in this.
Because at the end of the day, a sustainable health future isn't just about adding more years to our lives. It's about adding more life to our years. It's about building a world where everyone, no matter who you are, no matter where you live, has a real chance to live a healthy, fair, and dignified life. So the real question is, what part are you going to play in building it?